Welcome to ProtectYourBrain.com's daily worldwide webcast. I'm William A. Van Horn, MD, a medical doctor who specializes in Alzheimer's disease. The purpose of this webcast is very simple, to answer your questions. So please send us questions. You can email, you can Twitter, you can go on Facebook, you can call our toll-free 800 number. I want questions. I know, working with hundreds of Alzheimer's patients and their families, that they have questions upon questions. And I know, as a busy physician, I don't have time to answer all their questions. The goal of ProtectYourBrain.com and the Alzheimer's Journey DVD series is to answer those questions, and this is one way I do it. You can send me a list of medications, you can send whatever, and I will look at them and I will answer your questions. Today, I'm going to answer a very simple question. What is Alzheimer's disease? Now, as simple as that question is, the answer is complicated. Let me tell you how Alzheimer's disease was first discovered and named. Dr. Alzheimer's, about 100 years ago, had a patient come in who was significantly lacking in cognitive ability. She had lost a lot of her memory, her ability to function. She died, and when she died, he did an autopsy. When he did the autopsy, he went into her brain, that means cut it open, and he looked at what had happened inside the brain. And he found these abnormal inclusion bodies in the brain, one of them called amyloid plaque, there were other things. But the amyloid plaque was what he found most of, and that's what Alzheimer's disease has been defined by for 100 years. So they found these things, and they're formed, after the brain dies, they form into these plaques. And we have been calling Alzheimer's disease, for the last 100 years, these amyloid plaques. Now, the problem that's arisen out of that is that we were seeing what was in the brain after the brain had died. This is like if you took heart disease, and let's say someone's dead, they go in, they look at their heart, and they find out that part of their heart has died. So they call heart disease dead heart, and they try to find medicines to get rid of dead heart. That's what we've been doing with Alzheimer's disease for years upon years, trying to find medicines to get rid of amyloid plaques, which I believe is simply dead brain. That's what they've been calling Alzheimer's disease. Well, if that's not Alzheimer's disease, what do I think Alzheimer's disease is? Well, first you've got to know what dementia is. Dementia is the broad category for losing thinking ability because you've lost brain cells. Alzheimer's disease is one type of dementia. It's the most common type of dementia. Why is Alzheimer's disease the most common type of dementia? Because Alzheimer's disease is a function of an aging, dying brain that ages and dies over decades. So therefore, we're getting an explosion of Alzheimer's disease right now. Why? Because people are living longer and longer and longer. Your brain starts aging when you're about 25 to 35, and it ages over the next 10, 20, 30, 40, 50 years. So what is Alzheimer's disease? What I believe Alzheimer's disease, which is incredibly empowering for you, is Alzheimer's disease is your brain aging and dying over decades, until a point that you get disabled by the loss of thinking ability. What's been going on for decades is we start treating people when they're disabled. They've already lost their brain. Early Alzheimer's disease is when you start early on losing memory. That's when treatment should start. Preventing Alzheimer's disease starts way back here when you're younger by keeping your brain alive, healthy, and energized. And there's a lot of ways you can do that. So when someone asks you, what is Alzheimer's disease? It's the most common type of dementia. It's the loss of thinking ability due to the loss of brain cells, due to your brain aging and dying over decades. Please send me questions. I'll answer them every day.